Welcome back to another episode of Cafecito con NHCOA. We're about to continue our exploration into the world of COVID-19 treatments. I'm delighted to have Dr. Hector Cabrera, Associate Chief Medical Officer for Premier Health, back with us for part 2 of this important conversation. In part 1, we explore the available treatments, their effectiveness, and who should take them. So today, in part 2, we will answer questions such as, how do we access these treatments? What are the risks and side effects we have to consider? And how do we know which treatment might be the most effective for us? So Dr. Cabrera will be our guide through these questions, providing valuable insights into the accessibility of treatments, shedding light on potential risk, and also helping us understand how to make informed decisions about the most suitable treatment options. Welcome back, Dr. Cabrera.
Right now, we're in a period of transition where these medicines were purchased by our government under an emergency use authorization. And when there was an emergency of the pandemic, and those supplies were made available to pharmacies all over the country. We still have some of those supplies. They haven't gone. Those medications are free, cost-free. But those supplies, so number one is the pandemic emergency is officially over. And so there's no more of those medicines that are going to be coming. Number two, those supplies are dwindling. And so it really depends in your community, whether there's still some of those supplies available. I would check with the large pharmacies. They were given it first, like Walgreens, CVS, and Walmart. And I would check with community health clinics. Those clinics, those FQHCs, were given these medicines in large supplies too. I would check them. So what's the transition from government-provided medications as part of the emergency now to commercialization, where your insurance would have to pay for this medicine, and Medicare and Medicaid will cover it. Private insurances will cover it. Obviously, what we worry about is how our patients who have no insurance are going to be able to afford these medicines. They are really expensive. I know, what the government paid for them. Paxlovid, they paid over $500 per pack. It comes in a 5-day pack. And for Lagevrio, it was $700, but I still don't know yet because in my community, my patients are still getting it for free. The government supply is still available. So I don't know how much the retail price may be. There's going to be programs. Pfizer is the company that produces Paxlovid. And so one thing that we're working with is contacting these companies to see what sort of assistance program may be available for our patients without insurance. So it's still to be determined. It is a problem that we're going to worry about because, especially for our patients with highest risk, this has been a huge benefit. That is something that really needs to be worked out with your doctor or your healthcare provider. Important thing, so if you go and seek treatment, is to know the medicines that you're taking. And so you need to be honest. You need to tell them everything that you're on, including herbs and supplements. There's certain herbs and supplements like St. John's wort that do interact with the Paxlovid. So everything you're taking, that's number one. And your doctor sometimes may do blood work or review your blood work to check your kidney function with Paxlovid. So knowing that, knowing the list of your medicines, your doctor is going to be able to figure out the best medicine. We always try to prescribe Paxlovid if you can, but not everyone can take it. We've got an alternative that'll help as well. it's a big worry because so far, these medicines were really developed around the time of Omicron and focused on that variant. The unknown is what will the virus do? And of course, there's been variants and changes since then. Unfortunately, these COVID antivirals have been proven to be effective against the current circulating variants. The big unknown is how will that virus change again? And will it change in a way that'll make these treatments ineffective? So that's a worry. There are minds working for the NIH and researchers for these pharmaceutical companies that are continuing to develop new treatments that hopefully will be available for future variants. But it's a worry, it's an unknown, but so far so good. We worry and we're beginning to see, getting COVID isn't just like getting any other illness. Even if you get better, there's risks of long-term problems, what's being called long COVID, or some people develop injury to their lungs or injury to their heart. And so you want to try to prevent the illness, first of all. So take care of yourself, get vaccinated. But if you do become ill, you want treatment, especially if you're at high risk, because you do not want to develop severe disease. Prevention is the best treatment. I encourage the vaccination, continuing to take care of yourselves. If you're ill, wear a mask. If you're coughing, wear a mask. And then know that these treatments are out there, particularly if you're at high risk.
So we have concluded another insightful episode of Cafecito con NHCOA. A heartfelt gracias to Dr. Hector Cabrera for guiding us through the intricate world of COVID-19 treatments. Let's keep the conversation going, stay informed, and share this video with your loved ones just to empower them with this informative video. Thank you once again for joining us on this Cafecito con NHCOA. We appreciate you for being part of our community. So take care and until the next one. Hasta la próxima.